Hi, Bruce. It's great to have you here today, and I look forward to learning more about your experience with OAB and BPH and how GEMTESA has helped you. If you could start by briefly introducing yourself, that'd probably be a great place to start.
Thank you, Dr. McVeary. I lived just outside of Boulder, Colorado for 44 years. I've been married to my college sweetheart for 46 years. We have 3 grown sons who live with their families on the West Coast. I retired from my professional life as a government administrator and university adjunct faculty member over 12 years ago. I'm a serial organizer, and I've kept busy with volunteer community projects my entire adult life. I've been a serious competitive runner for nearly 50 years. I'm 71 years old and one of the fastest men in my age group in the United States, if not the world. I've been a journalist for regional and national running publications for many years. And running and staying active have been my passions for quite some time. And I love sharing my enthusiasm for that with others.
Well, thanks for sharing a little bit about yourself, Bruce. That's remarkable. If we could discuss your experience with OAB and BPH. When were you first diagnosed with BPH, and then what was the discussion that led to that diagnosis?
I was first diagnosed with BPH by my doctor in 2015, but I'd been experiencing symptoms for quite some time before that. I did have some symptoms that I now know are primarily associated with BPH, like slow and intermittent stream, as well as symptoms of urgency and frequency. I told my general practitioner about my symptoms during a routine physical exam, and he diagnosed me with BPH, the same condition my father had when I was growing up. Once I started treatment for BPH, some of my symptoms improved. However, I was still experiencing frequency and urgency, and these symptoms were quite bothersome. I just figured that they were a normal part of aging.
So how long after your BPH diagnosis were you diagnosed with OAB?
OAB was actually not a term I was familiar with until recently. My initial diagnosis from my doctor was for BPH. It wasn't until my doctor referred me to a urologist that I was diagnosed with OAB in addition to BPH. I couldn't really differentiate between my BPH and OAB symptoms. As I mentioned, my most bothersome symptoms were urgency and frequency, and they hadn't gone away after I started treatment for BPH.
Well, let's dive a little bit deeper into your symptoms. How did the urgency and the frequency impact your overall life?
The frequency and sense of urgency really affected my training schedule and ultimately my performance on race day. It's hard to race my personal best when I'm having to go to the bathroom so many times in a 24-hour period. I tried reducing my liquid volume to help with the frequency of bathroom visits, but this did not help.
And so how did you first learn about GEMTESA?
I had not heard of GEMTESA until my urologist told me about it. He told me that he had prescribed it for several of his patients and that they had good experiences with it.
Had you tried other therapies before taking on GEMTESA?
I tried many therapies for BPH, including alpha blockers and others. However, I did not try any therapies for OAB before trying GEMTESA.
Did you have any concerns about OAB treatment? And did you discuss these with your doctor?
When my condition worsened, I started researching OAB therapies on my own and found out that in severe cases, surgery may be necessary. This was quite unsettling to me as my father passed away from a heart attack just 2 days after he had surgery for his BPH symptoms. Losing him was hard on me, and it was an event I never really quite recovered from. I explained to my urologist that I didn't want to get to a point where I needed surgery, and he spoke with me about all the possible treatment options. One of those options was GEMTESA. I trusted his opinion based on his extensive experience and with different treatment options. My doctor explained to me the most common side effects, which included headache, urinary tract infection, nasal congestion, diarrhea, nausea, and upper respiratory tract infection. After discussing the possible side effects, I ultimately decided to begin treatment once a day with GEMTESA.
Well, how's GEMTESA helped you?
Taking GEMTESA once a day for 12 weeks, I noticed improvement in my symptoms of urgency and frequency. I've been on GEMTESA for about a year, and its positive effects have continued. This is my own personal experience with GEMTESA.
Thank you so much, Bruce, for sharing your story with all of us and also discussing how GEMTESA has really helped you. I understand that patient results may vary, but I'm happy to hear that your experience was really quite positive. So good luck on your future races.
Thank you.
Indications and usage. GEMTESA is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. GEMTESA is contraindicated in patients with known hypersensitivity to vibegron or any components of GEMTESA. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking GEMTESA. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue GEMTESA in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with GEMTESA. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue GEMTESA and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with GEMTESA were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.